Hello, everyone. It's great to see so many of you here. My name is Dr. Himani. Um, I am one of the people facilitating today's program, and I also have Dr. Rajkumari and Miss Amu and Miss Renuka here with us today. So I'm so happy to see so many of us here. Just a little bit of housekeeping before we begin. If everyone can keep their audio and video off while we have a quick presentation. So we'll just have a quick review of what happens to cognition in the presence of anxiety. And after that, we will open up for discussion. We request all of you to put your questions in the chat just because there's like a large number of us and it can just get quite chaotic. So request all of you to keep your audio and video off and to please put your questions in the chat. And we're just going to get started right away. Can I request all of you to please keep your audio and video? I can see that quite a few people still have the audio and video on. So if you could just keep that off for now, and then we can get started straight away. And please put your questions in the chat, and we'd like to open up for discussions a little later. So I'm just going to hand over to my colleagues, Ms. Amu and Ms. Renuka, to begin. Thank you.
Good afternoon, everyone. I welcome you to the public lecture for the day. It's titled Anxiety and Cognition. I'm Renuka and my colleague, Ms. Amu. Both of us will be making this presentation. We will be discussing how anxiety affects attention, concentration, memory, planning, its positives and negatives, and ways to lessen the negative impact. So just to have a brief overview, we will be talking about what is anxiety, followed by just taking a quick look at what are the cognitive skills that we use in our day-to-day life, how anxiety and cognition are interrelated, the impact of anxiety on cognition, both positives and negative, and how to handle the negative impacts. So, just to begin with, let us take a very simple example. Imagine that you're trekking in a jungle and suddenly a tiger appears in front of you. What do you think you would feel in that moment? If you could just quickly tell us in the chat in a minute, what do you think is happening with the person here in the picture when the tiger is in front of them? Yeah, right. So the person will feel very fearful. They'll panic. He might go blank. There might be, somebody has said there might be adrenaline rush, fight or flight. Right. So most of us would immediately feel scared or fearful. Now, what does that mean? What does that feeling fearful mean? We notice it in our body in terms of our heart beating very fast. Some people might experience a lot of sweating. Some might have a dry mouth. Some might feel that their legs have gone all cold and shaking. These are all automatic and completely normal reactions in the face of danger. From an evolutionary perspective, these bodily responses is what helps us to survive by alerting us of the danger around us and preparing the body to either fight with the danger or run away from the danger. So it is useful when there is a real threat around us. But what about the times when there is no imminent danger or when there is no immediate danger and we still end up experiencing these bodily problems or these cognitive problems that somebody pointed out that our mind might go blank. This is what we commonly refer to as anxiety. So to define anxiety, we define anxiety as the emotion. Just a second. So, to formally define anxiety, anxiety is an emotion characterized by a sense of apprehension or uneasiness, along with the physical or somatic symptoms like the ones we just discussed in our example. It usually arises when an individual anticipates an impending danger or misfortune. Importantly, the threat may not be objectively present or it may be exaggerated in our minds. So, anxiety is not just about the fear in the present moment, it is often about fear of what might happen in the future. So we saw a couple of physical signs of anxiety, right? You also mentioned that you were kind enough to mention in the chat box what these are. So to just quickly look at it, when we are anxious, we might experience that our heart is beating very fast. We might also breathe very rapidly. Some people might feel that their muscles are feeling tensed as if the body is preparing to run away from the situation or to fight with the situation. There can be some long term consequences, such as some people might experience stomach upset, some people might experience some sexual concerns. These symptoms can be very uncomfortable and frightening, and often can be mistaken as a sign of a medical problem as well. Along with these physical symptoms, we often see certain symptoms which are cognitive in nature. So, when I say cognitive in nature, we talk about symptoms that affect how we think and how we process information. So you can see a person sitting down and holding his head with multiple tabs open, right? So this is what essentially anxiety looks like, uh, more cognitive terms. So it can be that we have difficulty concentrating on a particular task. We might be feeling very restless. We might experience a racing mind filled with multiple thoughts at once. There may be problems with memory, such as forgetting small or routine things and difficulty making decisions. A common feature that we often see is imagining the worst case scenario or repeatedly thinking about things that could go wrong. Many individuals also feel so overwhelmed that anxiety begins to interfere with their work, studies, or their daily responsibilities. So when we talk about these cognitive difficulties, we've seen certain cognitive difficulties that we commonly experience in anxiety. Let's also quickly take a look at the cognitive skills that we use in our day-to-day lives. So we've listed a couple of cognitive skills, such as attention and concentration. So what attention and concentration basically would mean is our ability to focus on a task for a sustained period of time. This we see or observe in our day-to-day experiences, such as when we are engaging in a conversation or when we are trying to read and understand something new. Next is something is memory, which we see both in short term and in long term. So short term memory can be something where like information that we retain very briefly, such as when we remember the OTP to give it to a delivery person, or something that we retain for a very long period of time, such as important events that have happened in our life, personal experiences, or the informations that we've learned in the past. Then we come to cognitive flexibility, which basically means how well we adapt our thinking when a situation around us change. So it helps us in solving problems where we consider alternative solutions to the problem at hand. It can be seen when we modify our plans and accommodate last minute changes. It can be seen when we are learning from experiences that have happened previously and we are trying to find a new way of thinking about the problem. Next, we have inhibitory control. Inhibitory control basically refers to our ability to suppress distractions, our ability to suppress inappropriate responses in order to stay focused on a goal. So this looks like maybe when we resist our urge to check a phone notification while we are trying to finish an important presentation, or when we decide that we should not react emotionally in a certain stressful situation because we have better options of reacting available. Next, next cognitive skill that we often use is planning. So basically, planning involves setting goals, prioritizing tasks, and anticipating future steps that we need to take in order to achieve the goal, and managing our time and resources. So we do use planning in the smallest things like organizing our schedule on a day-to-day basis, and also bigger tasks, more complex tasks such as planning a vacation. Next, we have decision making, where we weigh different options, we consider their possible outcomes, and we choose the most appropriate course of action suitable for us. This again ranges from major life choices such as selecting a career path, buying a car, making a financial commitment, or to very small or everyday decisions like what to wear and what task to do next. So now I hand it over to my colleague, Ms. Ammu. She will be talking more about how anxiety and interferes with our cognitive abilities and the science.
Thank you, Renuka. I hope I'm audible. Uh, my name is Amu, so I'll be taking the presentation from here. I'll just start off with a very small activity, which you can all do wherever you're sitting. Could you please just try and name some fruits in your mind? Okay, quite easy task, right? Now, I want you to try and say the alphabets backward, like Z, Y, X, W, okay, while you name the fruits. So I'm going to give you a few seconds to try and do this. Okay. So, if possible, if you could, few of you could just put it up how it was. Was it easy? Were you able to do it? How is it to, you know, it's tough. Yeah. I can see some responses saying that it took some time. It's quite challenging. It's a little difficult. If I just say name some fruits, probably that would have been quite easy for you. That's an easy task that we could have done, right? But when you have to do the same easy task while you have to say the alphabet backwards, it's getting a little difficult for you. It's getting tough. It's getting messed up, right? So that's probably how this anxiety and cognition relates. Like how Renuka explained, right? There are many cognitive skills that we use on a daily basis. Those come naturally to us. We are able to use it. We are able to pay attention, plan, you do decision making. All of that we are able to do. But when anxiety comes into picture, some of these easy tasks become slightly more difficult to us, right? So probably I'd be focusing a little bit more on how this impact happens. How is anxiety interfering with these tasks? Okay, so is it all bad? So that's the first question, right? At this point, probably we need to understand if anxiety is only doing bad to cognition. Not necessarily. What if we're feeling very fatigued, we're feeling sleepy, we're feeling very low? Then maybe the right amount of anxiety or the right amount of arousal is important for us to feel that, to perform at that optimal level. So this is a particular theory that proposes that at optimal levels of arousal, it actually helps us to perform better or perform at our best. For example, if you have an exam, let's say, right? If you have the right amount of anxiety, if you're just worried to the right amount, you might revise a little bit more. You might write down some notes. You might try to revise just before the exam so that you can remember things, and you will actually perform better in the exam, right? Similarly, but what actually happens when it's too high? What happens when the anxiety is above this optimal level? When this arousal is above the optimal level? That is probably when the performance declines. Now we probably focus on this end of the spectrum, right? When the anxiety is too high, how is it interfering with our day-to-day cognitive skills? Like Renuka mentioned, so many of the day-to-day cognitive skills that we use, right? On our day to day to finish our day to day functions, like probably difficulty in planning and organizing. It could be difficulty in planning small things like work appointments or managing deadlines, or even fun things like planning a vacation. Everything might seem like it's a whole big task when there's anxiety involved in it. It also sometimes leads to avoidance altogether, right? Because it feels like it's such a big task to plan it, there is avoidance, which we often refer to as procrastination. Then there is a whole vicious cycle of procrastination, anxiety, and inability to plan as well. Also, another common difficulty that we see is inability to concentrate or difficulty to concentrate. We often have a lot of anxious thoughts when we are in a stressful situation. We are preoccupied by that, and because of that, we find it slightly difficult to pay attention or enough attention, long enough attention to complete the task. This comes with difficulty registering some information that comes our way as well, right? A lot of information comes our way, and sometimes we are not able to register that properly, and because we're not registering it properly, we're not able to recall it when we have to as well. Like, for example, when we have probably a presentation coming up, and just before the presentation you have a meeting, sometimes because you're really anxious about the presentation, you end up forgetting things that were told in the meeting. In the presentation, if they ask us something about the meeting, we might have completely forgotten what was told in the meeting because you're anxious about the presentation throughout the meeting, right? Similarly, another difficulty on a day-to-day basis could be difficulty in decision making. Sometimes we have so many options, and when we're feeling anxious, we might feel stuck. We might not know what to choose. Another difficulty is of cognitive flexibility. That is, it is our inability to adapt to change, especially if something changes last minute. It might be very difficult for us to quickly make that change when we're feeling too anxious. These are some of the common day-to-day impact or like effects that you can see anxiety has on cognition. Now that we know all of these effects that anxiety has, we could probably try and understand how is this, what is actually happening in our brain when all of this is happening, right? So when we look at our brain, we can see that there's a particular part of the brain, it's called amygdala. You can understand that as like an alarm system. Okay, so the alarm system, it grows off when it detects any danger. So if there is a danger, the alarm system goes off, it becomes very loud. Okay, there's also a part, it's the anterior cingulate, that's like the controlling knob. So it can either reduce or increase the volume for you. Can either give the information that the alarm has to be amplified or that the alarm has to be slightly quiet, right? Then comes the prefrontal cortex. That is like our manager. So the manager does everything logically, it plans it out, it plans everything out for us, regulates us. So what happens is that when we are in an anxious situation and we're trying to do a cognitive task, even when the manager is trying to get to their work, the alarm system has gone off. The alarm is really loud, because of which it becomes difficult to get those tasks done. So the prefrontal cortex here, when we're feeling anxious, the effects in the prefrontal cortex probably dampens, and the amygdala is the one that is enhanced. Now, if I zoom out a little bit and we try to understand this in terms of some brain networks, we can see that there's one network, that's the default mode network. This is the one that mostly becomes active when the mind is inwards. That is when we are worrying or when we are ruminating or when we are thinking, what if this happens? What if that happens? That is when this default mode network is active. That's like our worry network. Then there is the central executive network. That's the one that helps us with attention, working memory, goal-directed thinking. It helps us to focus in a task. And the relationship with both of this is that when one works, the other might not be as active. And the switch for this is the salience network. It is the one that shifts the resources that we have between this worry mode and this task mode. It is the one that helps in this shifting. There's this very interesting study by Najmi et al. In that they speak about how cognitive load is basically the difficulty of a task, right? They speak about how when the difficulty of the task is actually low, like when you're only juggling like two balls maybe, when the task is an easy task, we actually tend to worry more as more resources are available to this worry network. And only some resources are being utilized by the central executive network, right? But when actually the load is high, that is, it's a more complex task, like you have so many balls to juggle around with, then we're actually able to utilize our cognitive abilities to focus on that. And the worry network do not have so many resources. So we actually perform better. So basically, the idea of it is that when we're engaging the brain with meaningful cognitive tasks, it doesn't always worsen the anxiety. In fact, it can help reduce the interference from worry by shifting the brain out of the threat mode and back into the task mode. There's another study that is actually done in Nimans itself. So here we see how in anxiety disorders in general, certain common cognitive tasks, right, like set shifting or like flexibility or working memory, inhibition, all of them are lower. But when a particular anxiety induction task was done, it was seen that all of these common cognitive skills even worsened. And it's seen that it often co-occurs with the emotion dysregulation as well that comes with anxiety. So now the question is, we understood how there are so many negative impact that probably anxiety has on cognition, right? But what can we really do about it? How can we really reduce this negative impact? We'll go through some of the general techniques that you could probably utilize to reduce this negative impact. The first one is relaxation. As you saw earlier, anxiety tends to activate our flight or fight response, and simple techniques like slow breathing or grounding helps us to calm down this nervous system. Next is to organize, that is to write down some to-do lists, to use reminders, to just plan out the daily tasks so that you can keep things simple and it can help you reduce this impact. You could also talk to someone that you trust in order to reduce this anxiety. Often sharing your concerns with a friend, family member, colleague often brings clarity and perspective. Then comes very close to the organizing bit of it, planning ahead. That is, anxiety comes with a lot of uncertainty. Sometimes when there is uncertainty, anxiety amplifies. So planning ahead, like preparing for something, planning for the next day, maybe starting your day or ending your day with some planning, would reduce any last minute pressure. It also helps to break down a big task into small tasks. So when there is a big task in front of you, especially when you're anxious, it can get really overwhelming. So breaking them down into small, clear goals helps the brain to stay engaged. And instead of thinking, I need to finish everything right now, it helps us to focus on those smaller goals. It also helps to work smarter, that is to utilize the the time of the day when you feel more fresh, to work harder during that time and actually utilizing that to complete more tasks. Even simple lifestyle modifications like sleeping on time, doing some physical exercise, or maintaining a regular routine has a strong influence on cognition. Now, an important aspect that could actually help is sticking to a routine, right? Even simple changes like probably using a specific space as a workspace and not utilizing other space like maybe your couch or your dining table to work would help you to switch to that work mode much easier and much better. Also, if you have like a very messy environment and there's a lot happening, that could be that could induce some anxiety. So even taking small steps like decluttering your desk or even like a digital declutter could help improve attention and reduce the overwhelm. Even taking some time out of the day to just reflect and plan a few minutes, as I mentioned earlier as well, maybe the beginning of the day or the end of the day, to just plan out can bring in a lot more clarity. Another interesting way to help with this is to manage your fatigue and taking breaks in a very smart manner, right? So, planning out in your work in a particular way that you take smaller breaks in between. So, it could be something like working for about 15 to 20 minutes and taking 5-minute breaks in between. So that you are not trying to do a lot at once, right? So taking smart breaks is essential. It's also important to be persistent, because often anxiety comes with avoidance. That is, once we're feeling anxious, we wouldn't want to finish certain tasks. We would try to avoid it. So persistence is also key to this. Also, one major thing that we can actually do is to take a break when we're too frustrated. Sometimes, even when we are frustrated, we try to push through and try to finish the task. But the smarter thing might be to just take a smaller break and continue the task after that. So this brings us to the end of some of the easy techniques that you can utilize on a day-to-day basis to help some amount of anxiety. But if the anxiety is very high, or if the impact of cognition on anxiety for you is very high and you think you might require some help, you should probably consult a mental health professional. Thank you.
Thank you so much, Andrew and Renuka. And I can see that there are already lots of questions on the chat.
Ma'am, we are not able to hear you.
Okay. Can you hear me now? Can you hear me? Okay. If you wanna. Can. Hello?
Please give us a moment.
Hello. Can you hear me now?
Ma'am, you are audible, ma'am.
Okay, that's great. Sorry, I think I got a call in between, and so that sort of just interfered with my phone audio. So I'm so sorry about that. But there were quite a few questions there, which I seem to have now lost because I left the meeting. But I can see that. Sorry, I might need to just ask Amol to kind of just go over the questions. And my video as well, I think.
Yes, ma'am. We're just looking at the question.
Yeah.
The first question is, I want to understand the correlation between anxiety and neuroplasticity, and also which hemisphere of our brain gets affected.
So, if you could also just allow my video as well. Looks like I'm not able to. But yeah, so I think like we were discussing earlier in response to this question, what seems to happen within the brain, I think we already presented that the amygdala is where we actually feel the emotion, but there are parts of the frontal cortex, that is the anterior cingulate, which sort of amplify the anxiety or help us regulate it a little better. And the prefrontal cortex is what really helps us. So there's no one single hemisphere. By hemisphere, we mean left versus right. So it's not really a hemisphere that affects anxiety, but it's specific brain areas. So that's about that. And I think there was another, sorry, the next
Yes, ma'am.
question.
One person has asked that they're a school counselor. Most students are anxious. Please help me with giving my students some tips to manage anxiety, improve focus in class.
Right. So we did already discuss a few tips. So I hope that that was helpful. But often I think we tend to forget also that the simple things are what really help with anxiety best. Simple things like sleep, exercise, food, that sort of thing. I think that makes a okay. All right. So my video should be back soon. Yeah. Sorry about those little glitches. So it's those simple things that actually help quite a lot with the anxiety. And then a lot of the other things that some already presented, like the breaks, helping to declutter, usually things like that help. Sometimes if the anxiety is quite severe and disabling, it probably requires professional help. So this is a clinic that we run at the Nimhan Center for Wellbeing. You can see that on the screen. So this is in BTM layout. This is an outreach clinic that NIMHANS runs, that we personally, all four of us are involved in. So, and, you know, we can certainly see people who have quite severe anxiety and also refer to appropriate services at NIMHANS if needed. I'm going to go to the next question.
Yes, ma'am. If PFC shuts down during an anxious situation, how well does awareness and knowledge or memory of coping help to manage it?
Absolutely. I think that's a fantastic question, and it actually really feeds into what we'd like to do. So the prefrontal cortex is what actually helps with regulating anxiety. So the more we can strengthen the activation of the prefrontal circuit, the more we can actually manage our anxiety better. So that's sort of some of the things that we're doing as well. I saw that there was another question about retraining, so I'm just going to take that now as well because it links in. So we are actually doing a few studies here at NIMHANS. We are looking at how we can train the prefrontal cortex a little better. So you can see that study up there. So we are looking at how we can train the prefrontal cortex a little better to kind of kick in when one gets anxious. So how can we train the prefrontal cortex to be more active so that it can inhibit the anxiety response in the brain. So we're actually, therapy helps, but we're also trying a novel treatment called cognitive training, which is what someone has asked a question about. So we're looking at how can we strengthen the prefrontal cortex? How can we make that more active during anxiety so that it can override the anxious response. So that's what we're trying to do. And if you're interested, you're welcome to participate in the study. It's an intervention study. It's for 8 weeks. We have some specific criteria, but the intervention is otherwise free. It includes assessments, it includes the intervention itself. So if that's something you're interested in, please reach out. We have the number and the contact details at the bottom of the screen. So that's something that can be done. I just saw that there was a question about emotional intelligence. That's a slightly different topic, but it connects a little bit to emotion regulation. So we have, so emotion regulation is something that we train in most therapies, and we believe that cognitive training and emotion regulation are quite tightly linked. So that's sort of what we are trying to look at in some of the studies that we're doing at NIMHANS. Do we want to go to the next question? So any related questions, we can do that together. Otherwise, we can just go to the next question.
Next question is regarding can you kindly explain, I think, a bit more about NIMHANS study to connect to this lecture?
Right. So there we go. So I think a couple of the studies that we mentioned, we've looked at. So one of the studies that we mentioned was by Ms. Neenu Jawahar, just finished. And we looked at people who had an anxiety disorder. So something with a diagnosis of anxiety. All of us have anxiety. It's perfectly normal. It's good to have anxiety. It's disabling anxiety that we are talking about. So when someone has a diagnosis of anxiety disorder, we compared that to people who didn't have a diagnosis of anxiety disorder. And what we did was we compared them under neutral conditions. So we tested them on some cognitive functions in absolutely neutral conditions. And then we actually induced a little bit of anxiety, just a little bit of performance anxiety, which all of us go through in everyday life. We just induced that a little bit and we looked at what happens. So we're not supposed to do anything unethical in inducing anxiety. So we can only do what people would anyway usually go through. So that's what we did. And we found that when people have anxiety, what seems to really worsen, especially, is verbal working memory. So this is what happens when we are ruminating, when we are worried. What if this happens? What if that happens? That seems to be what really suffers when we get anxious. And you'll notice this, like this happens with all of us. When we are very, very anxious, I might forget what I was just doing. I might forget what I was just saying, or I might find it difficult to hold 2 or 3 things in my mind. So that's exactly how anxiety seems to impact us. So the next step we're looking at is what can we do to not let anxiety impair functioning. So we have several ongoing studies which are sort of related to this. So we're looking at what happens if we reappraise at that time. What if we think of the situation a little differently? We're also looking at this training intervention. So it's stuff like that we are looking at. Okay, the next question.
When in an anxious state, the brain tends to freeze, right? How can we equip someone in an anxious state to break things down into smaller, specific goals if they have a lofty task in front of them?
That's a great question. And I think it's like you pointed out in the question itself, it's not something that we can do in one leap, right? It takes a lot of little steps to do that. So first we have to train our brain to calm down. And we have to do that with specific methods. So it could be relaxation, it could be some grounding techniques. So we have a number of different things that we use in therapy. But just calming down a little bit and then using that to shift attention to something else. That's what usually works. But first we need to calm down. So simplest thing to do is to take a deep breath, because that rewires the whole stress response of the body. So just taking a deep breath means we calm down automatically. So that's one quick thing, but there are lots of other things, and you can that's some of the things we discuss in our interventions as well. So happy to go into detail there. The next one.
There's also, it's like a statement, ma'am. It's constantly planning and having plan A, B, and
Yeah.
can also cause anxiety.
Yeah, Yeah. So over planning is a problem as well, but over planning when it's not helping goals, right? As long as it's helping a goal, it's good planning. But sometimes we can over plan, overthink, and that can just increase anxiety. So the idea is to do it in moderation, just like uh, the bell curve that we put up. Okay, I can see there are quite a few questions, so maybe I'll try and do those the next few months really quickly.
How does social cognition and including fear of negative evaluation and interpretation of social cues in individuals with anxious personality disorder?
Yeah. So social cognition, metacognition, many of these are related constructs, and all of them can do, like what Amo was describing in the slide, amplify the anxiety. So if we are using social cognition cues to interpret, the situation in a more threatening way, it can actually make us more anxious. But that means that we can also train it the other way. That means that we can train ourselves to regulate ourselves a little better as well. So all of this is part of the work that happens in the training. Okay, so next.
Sorry, ma'am. How do we know that it's anxiety symptoms and not something else with overlapping symptoms?
That's a bit of a tricky question, and I think that is something that requires professional intervention because definitely, especially the physical symptoms, can be part of so many things, right? If we climb up the stairs very quickly, we can feel fatigued, but there could be physical conditions that should not be ignored either. So it's always good to consult a medical professional or a clinical psychologist or a psychiatrist, a mental health professional. That's probably the best way.
Why do we stutter or forget words when anxious?
Okay, so I can actually see from here onwards, I can see the chat. So that's great. Yeah, so that's part of what we were discussing as well, that the cognitive functions can be affected when one is too anxious. So we might lose the word that we're looking for. We might not be able to find an alternative word. So that's part of, so that's what the prefrontal cortex does, supplies words. So when anxious, that can get overwhelmed. So I can see that there is also, in the midst of too much anxiety, how does one manage immediately? What are the solutions? So like I said already, deep breath is something that helps. And after that, there are a number of things that can be done, all of the things that we already described. Deep breath is a good way to start. About social anxiety, I won't go into too much detail on that, but it's essentially when one is anxious in social situations with other people, speaking in public, eating in public, that sort of thing. Cognitive retraining, I've already spoken about. So something about how to help teenagers to understand the difference between worry and anxiety. That is a little tricky again because they're so closely related. Worry can increase anxiety. Anxiety causes worry. It's a little difficult to make that out just like that. So it may be more helpful to, that's like an entire thing in itself. Like someone would have to spend an entire hour doing that. So it's a little bit of an involved question. There's something about how elaborating declutter. So declutter is sort of like if I come to my work desk and it's piled with food and papers and bills and clothes and everything else. It's very difficult for me. I can actually feel overwhelmed because I don't know where to start. I don't know what I need to do next. So decluttering is just removing the things that I don't need immediately. And essentially, that's what we do in our minds as well. Like if I have too many things going on at the same time, my mind is cluttered. So the cognitive training helps us declutter our own minds so that we're only thinking about what I need for this task, not 100 other things. Is anxiety hereditary? Yes, anxiety can be hereditary, but it can also be the result of environment, personality, and so on. So there are it's multifactorial, what we say. So there's a question about severe headache during anxiety. That can be one of the symptoms, like we said. So then the focus can be on actually addressing anxiety itself. But this may need help of a professional. I would suggest consulting a professional. So someone's asking about patients taking treatment at NIMHANS. Can they come to the clinic for therapy? Yes, certainly. The Cognite Clinic is part of the NIMHANS Center for Wellbeing, and we can see people who are already registered in NIMHANS as well. And we can certainly, have an initial discussion to figure that out. Exam-related anxiety, again, that's a broad question. But yeah, it's basically the fight or flight response in overdrive. Google Map link to the clinic. Maybe we can just share that on the chat if that's okay. Let's just do that. Another question on how to determine whether the student is only anxious or having other mental health issues. I think that has to be done by a professional. It's a little difficult to do that otherwise. So it's always helpful. If like we put up a lot of simple tips, simple ways to manage anxiety. And if it seems like the situation is a little bit more complex than that, then it's probably a good time to consult a professional, a mental health professional in private, at NIMHANS, wherever. So already took this question about emotional intelligence. There's one more about why do kids have focus and anxiety, getting in stuck mode, or when being questioned. Yeah, so otherwise may not have a problem in recollecting. If it has been very anxiety provoking, that can actually cause people to shut down a little bit. So I don't know, this seems like it's a very specific problem and it might need a more specific response. So it may be something to discuss with a professional, but broadly, I would say if being asked too many questions is anxiety provoking, it may be that the person is not able to respond. There is a question about contact. We can share contact details as well. It was on the slide. We can share that. And how to train the prefrontal cortex and how is this different from therapy? So what we are doing is not prefrontal cortex stimulation in the sense that it's not an electrical stimulation or like not magnetic stimulation. But this is actually through tasks. It's sort of having a lot of interesting new tasks, using that to kind of stimulate the functioning of the prefrontal cortex. It is slightly different from therapy. It's not hugely different. It's essentially the same thing. But in therapy, the process is more through discussion of the anxiety situations themselves. Whereas with our intervention, the cognitive control training, we are actually using tasks to help to strengthen the prefrontal cortex and therefore reduce the anxiety. So it's slightly different, but if you're more interested, please write to us. If you'd like to be part of the intervention, that's also something that we can figure out. How to find high functioning anxiety. That is also a bit of a complex, more specific question. It would depend on the person. A lot of us can function with anxiety. We might just find ways of avoiding certain situations. So that might be something to think about. Developing an intervention module. I'm not really going to go into that because that's not the subject for this discussion. The app is available, but it's being tested in studies right now. So it's not available for public use right now. There's a question on difficulty sustaining good habits. How to persevere and build a good routine. That it is a very tricky thing to do, but it's mostly through practice. doing it over and over again. But sometimes there might be things getting in the way. So it might be a good idea to seek professional help. You're welcome to reach out to us at the Cognite Clinic or through the intervention itself. How to differentiate normal and clinical anxiety? Like I said, normal anxiety, all of us have. Clinically significant anxiety can be disabling. It means that it's interfering with our ability to do the routine tasks of everyday life. That's usually a good way to see if something is clinically significant, needs professional attention. Yeah. Suggestion for app, I'm not sure what that means. Yeah, I already answered this question about being put on the spot. Exam anxiety. This has come up a couple of times. So exam anxiety again might be to do with because we're not able to think clearly, plan, etc. So it might be a good idea to reach out for professional help. Because like we said, the simple tips, planning in advance, taking breaks, relaxation, if those things are not helping, please reach out for professional help. Kids on the spectrum, anxiety can be comorbid, yes, and it can be more complicated. So it probably definitely needs professional intervention. Why does anxiety cause migraine and diarrhea? Basically, anxiety puts the entire system in overdrive. It means that all our physiological processes become heightened. So our blood pressure goes up, our heart rate goes up. We might start sweating, we might feel hot. Our digestive system goes into overdrive. So everything goes haywire. That's what anxiety does. Taking a deep breath, allows us to slow down the entire system. Scales, I'm not going to get into that so much. Geriatric anxiety, there can be a lot of different reasons for that. So probably needs detailed assessment. Geriatric populations are quite complex. In-person training we definitely have the study is in person. So if you'd like to be part of the study, if you'd like to come to the Cognite Clinic, all of the treatment is in person. Certificates for this, this is just an awareness program. There's no certificate because it's not a training program, so unfortunately. Training to mental health professionals, yes, we do periodically offer training programs. So please check in with the Center for Wellbeing team. Denial. Okay, I can see that we are running close to our end time. So I'm just going to take these 2-3 questions about denial. Denial is a complex question, needs professional attention. Internship, not for this talk. And about breathing techniques specifically. So these are a little bit more detailed. So I think that these are things that probably need to be addressed in therapy itself. Drashta Bhava, attitude of being a witness. Yes, it can help in reducing anxiety. There's also something that's cultivated in mindfulness. How to treat overthinking for current generation. Again, that's like a really broad question. It's an entire session in itself. So I'm going to stop there. And I think we have a few more. So this is the Cognite Clinic slide, and then we have several other studies going on. So this is another study where we're looking at cognitive strengths as well as difficulties. What happens when one is anxious? What happens when there is uncertainty? What happens when there is conflict? That sort of thing. And this is just a one-off thing. So you can participate if you have anxiety disorder, or if you don't, if you're fine as well. So we like to compare what happens when someone has an anxiety disorder. How is that different from when someone does not have an anxiety disorder? It's a good way for us to understand how anxiety functions. So this is that kind of study. It means it's just a one-off participation. So that if that's something you're interested in, you just want to find out how your brain works while anxious, this is something you can participate in. You also saw that there's another one with an intervention aspect to it. So if you'd like to work on your anxiety, if you'd like to try out the training with the app that we have developed, you can do that as well. And it's absolutely free. The intervention, if you meet our criteria, we would be offering the intervention to you absolutely free. If you don't want to be part of a research study, you can just reach out to our Cognite clinic. So that's also something that's available. Or you can also reach out to the NIMHANS Center for Wellbeing. And they will also talk to you if you don't necessarily have cognitive difficulties, if you have other kinds of difficulties. There are a number of other clinics as well at the Center for Wellbeing. So that's also something that you can reach out to. And if necessary, we would refer back to NIMHANS as well. So that's all of the stuff that is available. So thank you so much, everyone. This has been so helpful, so interactive. I can see that there were so many questions, and we will try and plan a follow-up to this as well. Unfortunately, there is no certification for this because this is more an awareness program, not a training program. But this is just a way for people to get some understanding of what happens and how to deal with anxiety. So I'm just going to ask if Ms. Amu, Ms. Renuka have something else to add. Dr. Rajkumari, if there's anything else to add. Otherwise, we'll wind up. Do we have anything else?
Thank you.
Thank you.
Thank you so much, everyone. Thanks a lot.
Thank you, ma'am.
Thank you. Thank you all. Thanks very much.